I'm a board-certified plastic surgeon, and tonight for the next few minutes we're going to talk about a very popular procedure called an abdominoplasty, or otherwise known as a tummy tuck. And my wife Ella is going to direct us through some of the questions and answers through this evening, and I hope that you'll find it informative.
Hi, so to start with, can you explain exactly what a tummy tuck procedure is?
Yeah, as I said before, the technical term is an abdominoplasty, but everybody refers to it as a tummy tuck. Think of it as a contouring procedure that removes excess skin and some fatty tissue on the lower part of your abdomen, and it also tightens up the abdominal wall muscles. So at the end, you have a really nice sculpted, flattened abdominal wall and stomach. A lot of women say it kind of brings back their pre-pregnancy body. Many men feel like it just restores it to a younger, more youthful look for them as well.
What qualifications should you look for in a surgeon?
Well, anytime that you're going to be looking for aesthetic surgery, your surgeon should be a board-certified plastic surgeon. There's a lot of board certifications, and you can be boarded in a lot of other specialties. But in this case, when you're looking for these kind of surgeries, you really want him to be, or her to be, a board-certified plastic surgeon.
Is this procedure considered an outpatient procedure?
For most of us, it's an outpatient procedure. Some surgeons like for the patients to stay overnight. I used to do it that way, but I usually let everybody go home. The only patients I keep overnight now are patients that come from a distance away. I have patients that will come from 4, 8 to 10 hours away. So I'll keep them overnight and send them home the next day. I do them in a certified, accredited surgery center. You can also have it done in a hospital. I would recommend that if you're doing it in a surgery center that you do your homework. The surgery center should be accredited, just like your surgeon should be a board-certified plastic surgeon.
So what areas can a tummy tuck procedure target?
It really it targets the front part of your belly, just think from your rib cage down to your pubic bone. And all of that front part of your belly, that will kind of be honed down. The muscles will be pulled in to kind of restore that hourglass figure for a woman and the male torso for a man. It can be combined for the hip area with some liposuction if you need that to be contoured as well. But the tummy tuck itself is just for the front part of the belly.
Is there a difference between an abdominoplasty and a tummy tuck?
Same procedure. One's just a technical name. The other one is just the name that the people have lovingly given to it.
So who would you consider to be an ideal candidate for a tummy tuck?
This is a good question because patients will come in, and the first thing I want to tell them is it's not a weight loss procedure, it's a contouring procedure. The other thing is people will come in and they have this idea about an ideal body weight. I would want to see you when you are about 10 pounds from your normal body weight. And what I mean by that is a weight that you carry through your normal daily activities, your normal eating habits, your normal workout or not working out habits, because then I can really evaluate you. I don't want you coming in after you've lost, on a crash diet 40 or 50 pounds, because you probably will gain some of that or all of that back. I don't want you to come in saying, what can I do? I want to lose 50 pounds. I really can't assess that. So really, I want to see you where you normally live. Weight-wise on an average day.
Can exercise tighten your skin with the tummy tuck?
Another great question, because I have patients that come in, both men and women, and that say, I run every day, I do the Stairmaster, I do 1,000 sit-ups, but the skin is still loose and draping. Skin is resistant to exercise in any form. The muscles can be toned, you can lose weight, but skin is really reliant on your normal elastic properties. And as we get older, that elasticity in your skin diminishes. If you've gained weight and then have lost it, or women that are pregnant and lose it, your skin will not react and stretch back or redrape very well. So it really is resistant to exercise of any form.
Can a tummy tuck procedure be combined with any other procedure?
Yeah, and it usually is. It's a nice operation to sort of set the core of your body, but we can combine it with a breast procedure, usually a breast augmentation. We lovingly call that the mommy makeover, because that sort of restores a mom's body, both breast and belly, back to its pre-pregnancy days. It can also be combined with a breast lift, a breast reduction. Another common area is the arms and the arms and the abdomen. Liposuction is another one that we combine it with.
Will a tummy tuck take stretch marks away?
Unfortunately, the only time that the tummy tuck will affect stretch marks is if the stretch marks are really between the belly button and the pubic bone. Anywhere in that area, because that paddle of skin is going to be completely removed. If it's above that or on the sides more to the hips, some of it may be affected, but otherwise it won't take those away. It will move them down. If they're above the belly button, it will move them down to the pubic area, but it won't take them away.
How would a patient prepare for a tummy tuck procedure?
There's really no reason to do anything outside of what you normally do. Like as I said before, I would want you to be at your normal workouts, your normal eating habits. There's really nothing to prepare for. We do them on patients that are otherwise healthy, so there's no special foods or special vitamins that you need to take.
What does your recovery look like after the procedure?
That's a good one. A lot of people think that tummy tucks are very painful and take a long time to heal. It's just really not true. Tummy tucks take about 2 weeks to where I let you get back to a lot of your exercising. At that point, it's light exercising. I really start increasing your exercising in about 3 weeks. 2 weeks, I get people back to work, activities of daily living. Your abdomen feels tight, but it's not that painful. I think what affects you the most, as opposed to other surgeries like breasts and arms and legs and liposuction, since we're going to tighten the abdominal wall, you don't realize how often you use your abdominal wall muscles. When you sit and stand, or you go from a lying position to a sitting position, also when you cough and sneeze, you'll use those muscles. So I think that's where you'll notice it more, that is sort of a deterrent at that point. But otherwise, it's very well tolerated, especially for women who've had children, especially C-sections. It's much easier to recover from than that.
Do you have bandages or garments that must be worn after surgery?
I use drains in this procedure, and most people do. They're usually out within the first week to 10 days. I use dissolving stitches that are under the skin. I seal the incision with glue. I use a very light amount of gauze, and everybody's in an abdominal binder. And you'll like that because it'll give you the support to kind of hold things and give you the support that you need after surgery. Most of the time I have patients wear that for about the first 3 weeks, and then we're really into more compression garments at that point.
So just to reflect back on that, where are the scars for the
Scars are down just above the pubic bone, so they're low enough that for bathing suits, bikinis, or any type of clothing, they should be under the waistband of the clothing. And they usually extend just to inside of your hips on both sides.
Is this a procedure a permanent procedure?
It is, as long as you're maintaining your body weight. It should hold up for many, many years. In all the years I've been going on, almost 16 years in private practice, I don't think I've ever really done, other than maybe a little bit of a scar revision, I don't think I've ever redone an abdominoplasty or tummy tuck once it's been done primarily.
We had a question come in from Liz. Does a tummy tuck look the same for everybody?
It does. They're similar, but because people have different body habitus, it really is geared toward your body habitus. I think the key to it, though, is your belly button, the shape of the belly button. There are different ways to make a belly button, and for me, I have a specific way I do it so that it looks natural. But for a woman, I want to accentuate the hourglass figure. I want to pull in your waistline a little bit more than I do for a man. A man should not have an hourglass figure. He should be more flattened on the sides. So I really try to accentuate the body habitus that you have, not what everybody else has.
Susie asked, should I get a tummy tuck to lose weight?
Again, it's not a weight loss procedure. You will lose a little bit of weight because we're going to take off that skin and the extra little bit of fatty tissue that you have. But again, it's contouring, not weight loss.
How would someone go about making an appointment to see you, Dr. Antimarino?
2 ways that are easy. Number one, you can visit our website at www.bellissimoplasticsurgery.com, and there's a tab on there about contact us. You can actually, through that, do an online virtual consult. I would also encourage you, even though you're doing that, it will alert me out. I can answer some questions for you, and then when you come in, we've sort of broken the ice. The other way is just to give us a call at 844-496-6647. And I have my main office in Shadyside. I have a satellite office in Monroeville. So whatever office is best for you and the most convenient, we're happy to see you at any time. Thank you all for watching. I hope this answers some of the questions about a very popular procedure. And if you have any questions, again, go back to our website at www.bellissimoplasticsurgery.com. Thank you.